So you're about to deliver a crown for your patient, and of course you need to check the occlusion. You place the crown in, the patient says, "Doc, the crown feels high." What do you do next? You're probably going to grab one of these guys, and this is probably 120 micron or thicker, these blue carbon marking papers, these articulating papers, and you're going to have them bite on it. You're going to see some spots. You're going to keep grinding it, and at some point the patient's going to say it feels fine, and you're going to finish the case. That's not the right way to do it. Instead, I would recommend you use a very, very thin paper. This is an 8 micron thick paper. It's double side coated, so it will leave a red mark on both sides, the opposing occlusion and your crown. But don't start with the side of the crown. First, you need to check how high is it, right? So this is our case. Here we have a crown going in on the maxilla and the mandible. Once you place this in the mouth, first start by checking the opposing side whether there's contact over here. So if they're able to hold an 8 micron paper on the opposing side, then we know that it's not that high, okay? You should check the adjacent teeth, either mesial or distal or both. And if you have contact there and they're able to hold that 8 micron paper over there, then in that case, this crown may not actually be high. It just may be a new feeling for this patient. However, if it is high, if they're not able to hold the paper on the right side, or they're not able to hold the paper on the adjacent teeth, then you should consider reducing the occlusion of your crowns to get it to hold here. So my metric for is the occlusion right is really the opposite side and the adjacent teeth. If they can hold this red paper, then I consider the occlusion to be satisfactory. And I usually start with this. So as you keep grinding down the occlusion, what happens is this opposing side will come into contact first, followed by the adjacent teeth. But remember, you still want contact on the tooth itself. So this 8 micron paper needs to be held by that tooth also. This is how you fine-tune your occlusion. Don't just take the big 120 micron paper, have them grind, adjust everything, because that's going to give you a lot of false positives and you're going to destroy your occlusion in the process. I hope I've confused you enough. This is the Dental Review Guy signing off with a smile.